Hi, Dr. Wright here, and I want to show some improvements we're seeing with our ladies with lipedema. And so we follow the gait, range of motion, and other mechanical parameters of the knees and legs of ladies with lipedema. And what we are seeing is that we're seeing improvements in the knee range of motion here. So this is the knee flexion with a goniometer, and we're seeing here she now has a normal knee flexion. Prior to surgery for her lipedema, she had an impaired, she had 105 degrees, she's now at 130 degrees. This kind of improvement is not only significantly improves her ability to get around, it also improves it also improves her quality of life, and so these improvements are comparable or better than what we see with a total knee replacement for someone who has end-stage arthritis in the knee. And so it's very important that we prove the value of these surgeries so that more women can get their surgeries covered and can get the treatment they need to live the best lives they can.